Hey, welcome back, podcast friends. And in today's episode is kind of a two-part thing. Basically, what I'm wanting to tell you about, this is the third part of a three-part series that I've just done. Um, the first one was just talking about an overview of what type 2 diabetes is. The second part was talking about what medications, the different classes of medications that are used to treat diabetes, and exactly how those classes work and what they do. And basically, what I was trying to show is that almost every single class, basically every single class, either works to get your glucose down by either raising your insulin, which makes insulin resistance worse, which means you're treating a symptom of high blood glucose, but your diabetes is actually getting worse because diabetes is insulin resistance and inflammation. High blood glucose is just a symptom of that. And um, so I let you know that's basically what's going on is the diabetic medications are actually making diabetes worse. So today I'm going to be talking about choices that you're making that you probably don't even realize you're making, and then go a little bit deeper into the adverse effects of these different classes that medications that are used for diabetes. So first I want to talk about the choices. There's choices that we make every single day. Some people are aware of these choices and they consciously pick which choice is the correct one for them that's going to get them to a higher goal, a goal that they're looking for. And there's other people who have no idea, they're just making choices and they just make any random choice because they don't really have a goal in mind. What I'm wanting to get you guys to understand is that if you have a goal in mind of being healthy and living a quality life and a longer life, then there's a choices that you're making that are totally against that. And so this is for the people who really do want to live a high quality life and longer, stay off medications, out of the doctor's offices, out of the hospitals. These are the people I'm talking to who if that's what you want to be. So first, we want to talk about nutrition because diabetes is a nutrition disease. It comes on because of the types of food you eat, and you can only cure it by the types of food that you eat. That's the only way. There never has been a medication that's going to help get rid of diabetes, and there never will be because of what happens. Because, like I said, all of our diabetic medications work by lowering our blood glucose, but that's just a symptom. Just like a lot of our medications work to take care of blood pressure, to keep our blood pressure control. That's just a symptom. A lot of people take drugs for cholesterol, for heart problems, for Alzheimer's, for anxiety, depression, all these medications, and these are just symptoms. They're symptoms of your body not having the nutrients that it needs to perform the way it's supposed to. Because our bodies are so magnificent. We don't even know. Scientists do not know how the body works. That's what science is. It's trying to figure out what has God already done? What's God done? How does he do this? How does the body work? And the problem with this, especially when you talk about drug companies, they isolate one little area. They pick that one little thing to fix that, but they don't realize how that's connected to everything else. And that is why every single medication, not just for diabetes, but every medication 100% has multiple adverse effects associated with them. So as I go through this towards the back end of this, I'm just going to go through them kind of quickly. I'm not expecting you to remember them or anything like this. I just want you to get the general feeling of, oh my gosh, if I take this tablet, it could cause all these other problems. And then you're going to have to take a tablet for that, which it has its whole set of other adverse effects. And that's how people get on multiple medications, higher and higher doses all the time. And it is crazy how many medications some people get on. And again, for those who don't know, I've been a doctor of pharmacy for over 30 years. So that's why I'm trying to get people off medication. I know what they do, and they're fine if you use them for symptomatic relief, but don't think you're curing anything by taking these. So first, when you eat, there are different reasons why people eat. Some of them are because emotional, they're bored, they're depressed, they're anxious. So there's a lot of emotional eating that goes on. Some of them do it for convenience because you've got grocery stores, convenience stores, gas stations, vending machines, break rooms, fast food restaurants. They have all these convenient little places where you can go and get some food to put in your stomach to make it where it doesn't feel hungry at that time. But what you need to be thinking of is your body, when it's hungry, it's not just wanting food. It's wanting nutrients. It's saying, I need nutrients in my body, and I need you to eat the nutrients that's going to make me feel good and be able to grow, heal, thrive, and survive. However, all these convenience foods, none of them are nutritious. There is hardly no nutrition in this at all. And I'll talk to you about what I mean by nutrition. But I really want you to think when you eat, is this food going to nourish my body, give it the nourishment it needs? Or is this just going to satisfy my stomach, but in the long run, it's actually going to make me much, much sicker and put me on medications and doctors' offices and hospitals? That's what you need to be thinking of, because most of the food that most people eat at these convenience places, that's exactly what it is. It's just things that are actually killing your organs from the inside. And then some people just eat because they're actually carbohydrate addicted. They're addicted to the taste of sweets. They're addicted to carbohydrates. And this is a true addiction. It is a true chemical addiction that happens. And that's part of what we have to work about when we're going to try to get people switching from that type of eating into eating for nutrition, is to realize that you are breaking an addiction. And it's just as strong, if not stronger, than something like a heroin addiction or crack addiction. Because with carbohydrate addiction, you look and it is everywhere. Nobody realizes this is actually killing us, because everybody's eating all these carbohydrates. Everybody's going to these fast food restaurants. Everybody is eating this crud from the grocery stores. And so I want my listeners to be different and understand that you do have a choice in your health. So as far as what we're talking about as far as nutrition, when you eat, if you're eating for the emotional reasons, bored, depressed, anxious, if you're eating for convenience, or if you're eating because you're addicted to carbohydrates, all those things are horrible for your body, because there's no nutrients whatsoever. All those things are made up of basically the same things. And that is, for those of you who haven't heard all my podcasts, that is that all these foods have glucose, which is the problem in the first place, because you raise your glucose too high, your blood glucose, because you're constantly eating carbohydrates, plant-based food that all gets turned into carbohydrates. Carbohydrates get turned into glucose. Glucose makes your blood glucose go up. That makes you produce insulin. Now your insulin levels go up, trying to get rid of that glucose, because it doesn't want high blood glucose either. But remember, insulin doesn't just make glucose disappear. It pushes it into your cells. It goes from glucose, it pushes that into your cells, and then it gets it turned into fat, and it pushes the fat into your cells. And I've talked about this with many podcasts, so I won't be going over all that. But that's what's going on. So when you eat this kind of stuff, it leads to toxic levels of glucose. Then it leads to toxic levels of insulin, which is the whole problem, is insulin resistance. Then it also, this type of food also, it has fructose in it, which causes inflammation in your body. And it also, fructose gets turned immediately into fat and gets stored. And then it has all vegetable and seed oils, and those are extremely inflammatory to your body. And I've talked about those too, about what's wrong with vegetable and seed oils. But there's two different ways that it causes inflammation in your body, and both of them are horrible. You need to stay away from vegetable and seed oils, and that will help with a lot of the inflammatory conditions that you may have, any arthritises or intestinal inflammations or any of that. So that's what I'm wanting to do, is I want you to get away from that, and I'm wanting to get onto nutrition health. And so just to explain to you what nutrition is, there are four main things that your body has to have. And really, these are the only four. If you can eat these four things, you will give your body all the nutrients that it needs to be able to do all the functions, keep you out of the hospital, keep you out of doctor's offices, keep you off medications, and keep you having a quality life. And these four things are protein, fat, vitamins, and minerals. Those four things are the only things your body needs. So let's break them down just real quick. And again, I've talked about these in other podcasts. And so I want to be able to get onto the adverse effects of all these drugs first. So I just want to go through this quickly. Proteins. Remember, anytime you eat a macronutrient, it gets broken down in the stomach and the intestines. It gets broken down to the basic building block. So that can be absorbed into your bloodstream, taken to the liver and all around your organs to be able to be utilized the way our body needs to help it grow, heal, thrive, and survive. So with protein, the basic building block, when you eat protein, like if you eat animal meat, that protein gets broken down to the basic building block of amino acids. Now, in total, there's only 20 different amino acids. But of those 20 amino acids, our bodies make up to 20,000 different proteins out of those amino acids. And some of these proteins could be up to 27,000 amino acids long. So we need protein. We use protein in everything. We use protein for our muscles. We use protein for our bones. We use protein for our cartilage. We need protein in our skin, in every single cell in our body, for our blood, and then also we use protein to make a lot of our enzymes and a lot of hormones. So we need protein for everything. So protein is so important. And yes, there are proteins in some vegetables. There's not a lot of protein in man-made food because they get rid of all the protein. They just want strict man-made food that you're going to get at a grocery store is nothing but pulverized carbohydrates, which means increased glucose in your body. Glucose, fructose, increased glucose, increased inflammation, and vegetable and seed oils, increased inflammation. There's nothing healthy about that food at all. Totally, you shouldn't even go to the grocery store to buy your food. Go to the local farmers, and that's where your food should come from. For this reason, they have no nutrients. They're totally nutrient void. So protein, back to what we were saying, protein is very important. Yes, plants have some protein. They don't have very much. So if somebody's trying to eat their nutrition with just plants, there's no way. They have to supplement because they don't get all the amino acids. Because as you know, we are animals. We are not plants. So when we eat animals, we get all the amino acids that an animal needs to grow, heal, thrive, and survive. When you eat plants, you get some of those amino acids, but not all of them. So you're going to have to substitute. And then that brings us into fat. Fat is so important. Fat is of ultimate importance in our body. Fat and cholesterol are good. Fat and cholesterol are vital. The only reason food companies and drug companies and everybody's trying to tell you that fat and cholesterol are bad is because their food is made out of animal or plant products. That's all it's made out of. So if you are eating nutritious food like animal products, then you're not eating their food. And they don't want that because they're a business. So they figure the best way for you to eat their food is to tell you that animals and fats are bad. That is a lie. That is a bold, blatant lie. Fat and cholesterol are very important. And just like we said, protein, when you eat fat, it also gets broken down to the basic building block, which is fatty acids. And there are two that are essential. There's omega-3 and omega-6. That means by being essential, that means that you can't get it. Your body doesn't make them. You have to get them from the outside by the food that you eat. And with the proteins we said there are 20 different amino acids. 9 of those are essential amino acids that you can only get from the outside by the food that you eat because your body doesn't make them. And a lot of those are the ones that we need to supplement, especially if we're eating just plants, because you're not going to get anywhere near the amino acids you need. So back to fat. So of those fat, we need fat. We need fat because it takes care of all our hormones. A lot of our hormones are made up of fat and cholesterol. Hormones that control our immune system and our nervous system. They also, because they're fat, you need to eat fat to be able to absorb your fat-soluble vitamins, which is A, D, E, and K, ADEC. Those are your fat-soluble vitamins. If you're not eating any fat, you're not going to be able to get any of those vitamins absorbed. So again, if you eat plant-based food, you're going to have to get these a different way, or you're going to have to come up with a fat that you can eat. The fat and cholesterol, they support the structures of every single cell in your body. Every single cell membrane in your body is made up of fat. And we are continuously tearing down our blood cells and building them back up, tearing them down. Or not our blood cells, every single cell in our body. All our cells are regenerating. They have different half-lives, but they all regenerate. So we're constantly making new cells. And so we need fat for all that. Fat also is a fantastic energy source. Fat gets turned to ketones, and our body runs way better on ketones than it does glucose. Glucose is great for a fight or flight energy. That's why we only have a little bit in our stores. But fat is good for our all-around energy. Our brain works so much better on cholesterol and fat. Our hearts work better on cholesterol and fat. That is a much better energy source when you use fat for your energy source. And then it also helps to keep your heart, your lungs, your blood vessels, your immune system, and everything working the way it should. So fat is very, very important. So the next ones are vitamins. And I'm just going to run through these just so you know. So vitamins, there are vitamins A, B, C, D, E, and K. Okay, those are vitamins. Now, of the B vitamins, there's actually several. So there's thiamine, which is B1. There's riboflavin, which is B2. niacin, which is B3, pantothenic acid, which is B5, pyridoxine, which is B6, biotin, which is B7, folate, which is B9, and cyanocobalamin, which is B12. So those are all the vitamins, and you get all those vitamins out of eating meat. And again, I'm not going carnivore on this. I'm not saying eat meat and that's all. However you can. And I know people who've lived their entire lives up until their 80s and 90s, and that's all they've ever eaten is meat and fat, and they do great. Just like the Inuit, they eat nothing but meat and fat, and they live great. They have less cardiovascular disease than anyone. So yes, you can. And then you can have your fruits and vegetables like a condiment, just every now and then if you want some to make your plate fine. That's fine. You just don't want to make all your meals of nothing but plant-based food because you won't be getting the nutrients you need. So you get all these vitamins out of eating meat and fat. And so that's the vitamins. The other one is minerals. And the minerals that we're talking about is calcium, phosphorus, sodium, potassium, magnesium, manganese, sulfur, chloride, iron, iodine, fluoride, zinc, copper, selenium, chromium, and cobalt. Those are your minerals. And again, you can get all your fat, all your protein, all your vitamins, and all your minerals straight out of eating animal fat with animal meat. And that will get all the nutrients that your body needs. If you're trying to get any of this from eating man-made food, you're not going to do it. And that's why everybody is getting sicker and sicker and sicker every year. And it is crazy how bad everybody has gotten. And I'll talk about that in just a little bit later. Now, notice I said fat, protein, vitamins, and minerals. I did not say that carbohydrates were needed, because just like there are 9 essential amino acids and 2 essential fatty acids, there are zero essential carbohydrates. You don't need them for life. You don't need any carbohydrates for any reason. So that's nutrition. So you have to decide, what are you eating? Why are you eating? Are you eating to give your body nutrients? Or are you eating just because of your emotional state, or because of convenience, or because of your addiction? And this is what I want you to realize, because if you think that's fine, I'll just eat this kind of food and I'll take a pill for it, I'm going to show you that is not the answer. 100% of all medications made, all medications, they may fix one thing, but they have multiple adverse effects. And here at the end of this, I'm just going to explain that to you just really quickly with the diabetic medications and all the adverse effects you see with this. So, if you are eating for emotion, convenience, or carbohydrate addiction, you need to remember that you will be putting on other meds like blood pressure meds, anxiety, depression, Alzheimer's, anti-inflammatory meds. I mean, just a ton of meds. And all of these have other adverse effects. So you can get even more and more medications on top. And that's why our medication list grows. Now, some medications, like the diabetic medications, they will treat the symptom and then the like high glucose, and that will bring the glucose down. But the way they do it is that raises insulin, or makes you more insulin sensitive, which means you're actually making diabetes worse, because high insulins causes insulin resistance. And that's what diabetes is in the first place, with the diabetes, with the high insulins and the inflammation. So some drugs will work on a symptom, but they can actually make the underlying condition worse. And then there's things like the statins, which, if you heard my podcast number 68 on what are all the most common adverse drug reactions with statins, you'll learn that there's nothing positive about statins. They tell you high LDLs are bad for you. That's a lie. They're not. They've never, ever been proved to have high LDLs causing cardiovascular disease. However, they are extremely toxic to your body. Not just the adverse effects, but the way the drugs work, the way statins work, are toxic to your body. So there are medications like that. And that's another reason they are making trillions of dollars off statins. So that's why they want to tell you that cholesterol is bad. It's a lie, but they're selling lots of drugs. So as always, they're making lots of money off you being sick. So remember, every single drug has adverse effects. So when the drugs come into market, they study in a small group of people, and in the small group of people, they find out some of the adverse effects, and they know that before the drug ever comes to market. And so they list, these are some of the more common adverse effects that we see. However, once it gets out on the market and it gets spread out to many people now see a lot of other adverse effects. And this is called post-marketing adverse effects. And we know that only about 1% of all adverse effects ever get reported to the drug company. And think about it. If you're eating something and all of a sudden, or if you're taking a medication and all of a sudden you get really nauseated or start throwing up, chances are you're not going to tell the doctor about that. And even if you do, the doctor may not go on and tell the drug company. So that's why only about 1% of any of these medications, adverse effects, ever get reported. Now, and drug companies actually don't mind if you say that their drug makes an adverse effects, because chances are they've got a pill to take care of that adverse effect also. So in their mind, they're just making more and more money on top of it. So I want you to realize that now we're just going to narrow right down to diabetic medications. And I want you to realize there's never been a diabetic medication in the 80s and 90s. There was not a single new diabetic medication made, because they didn't find that there was that many diabetics that would make it worth their while. Because back in 1980, and our food guidelines came out in 1977, so it took a little bit when they were telling everybody that fat was bad and carbohydrates were good. It took a while for us to see this huge wrong information and how that's affected our health. But now over time, we've seen it. So in 1980, we only had about 5.8 million diabetics in the United States. 5.8 million in 1980. After that, now today, that's gone from 5.8 million all the way up to 38.4 million people just in the United States that has diabetes. That's gone from 1980 to now. In the whole world, in 1980, there was only 108 million people that had diabetes. And now they think this number is up to 537 million. So it went from 108 to 537 million people with diabetes since our new dietary guidelines came out. And it's predicted that by 2030, it's going to go up to 643 million. And by 2045, it'll be up to 783 million. And the reason our diabetes rates continue to go up is because people continue to eat this man-made food, because the food manufacturers continue to market this in all your commercials, all your ads, everything, saying this is the good thing to eat. People believe them and they eat it, and they're getting sicker and sicker. And that's what I want to explain to everybody. Now, as we go through these adverse effects, and I'm going to go through them really quickly, just remember that the adverse effects that we're talking about are usually, they get reported when they affect 1 to 10% of the patients. Okay, 1% to 10% of the patients. So just to put in perspective, 1% of our patients, because right now there's 537 million adults. Or no, actually, wait. Yeah, 537 million adults with diabetes. So 1% means 5.37 million people. And 10% means 53.7 million people that are having these adverse effects. So this is no little thing. There are lots of people that are suffering from these. So like I said, I'm going to go through these really quickly. There's only 6 categories. And I talked about this in my last podcast when I was explaining to you the different classes of diabetic medications and how they work. Now, this is just going to be on their adverse effects. So the very first medication we'll talk about is the one that's been out almost the longest. And these are the sulfonylureas. And these are the ones that the generic name ends in ides. So there's chloropropamide, which is diabetes, glimepiride, which is amaryl, glipizide, which is glucotrol, and glyburide, which is glinase. And I'm saying these because as a pharmacist, we dispense every one of these medications I'm talking about every single day. We are constantly dispensing every one of these medications I'm talking about. So this is not a rare thing at all. And the way I'm going to do it is I'm going to talk about how many adverse effects were in pre-marketing, how many were in post-marketing, and then of those, I'm going to talk about the ones that are in our medication drug dosing handbook that talks about these are the significant considerations with this class of medications. And these are the ones you have to really be careful of. only put these on there if you don't have any other choice. And you always have another choice, which is your nutrition. And then some of these even go worse. And there's a black box warning that goes alarms all the physicians when they look at this. Be careful, be careful. This is going to cause this kind of adverse effect. So with the sulfonylureas that we just went through, so that's diabetes, amylyl, glucotrol, and glycinase. Before that ever came to marketing, there was 18 different adverse effects that it knew that this caused. After it came out, post-marketing, they found another 15 adverse effects. So a total of 33 different adverse effects that actually got reported to the doctors and then reported on to the drug companies. So there's 33 total adverse effects with these sulfonylureas. Of these, the significant ones, the ones that the doctor really needs to look at and say, okay, do I really want to put a patient on this? The significant considerations that they have, these all cause cardiovascular effects. So it can hurt both your heart and your blood vessels. It causes low blood sugar, which most of these do. It also, it's a real common allergy to have a sulfonamide allergy. And you get sulfonamide allergies with these also. So actually, the first ones were out there are probably the safest ones, and they still have 33 different adverse effects. So now let's go into the second one. The second one is called the Thiazolidinediones. And these are all the ones that the generic name ends in idazone. So you have pioglitazone, which is Actos, rosiglitazone, which is Avandia. And those two are the main ones in the thiazolidinedione. Before those ever came to market, they knew that there were 21 different adverse effects. Post-marketing, they found another 3. So there's a total of 24 different adverse effects with this. However, when you look at the significant considerations on this class of medications, they are very significant. What they found is these can increase your chance of bladder cancer, bone fractures, heart failure, edema, and liver failure. Those are major. You're talking about your major organs that keep you living and growing, and these directly affect those. And they even have a black box warning of congestive heart failure in up to 8% of the patients. 8% of the patients get congestive heart failure on these medications. And remember, just 1% with 5.37 million patients. So there's a lot of patients who are seeing this congestive heart failure. Now, the third category is going to be the biguanides, and that's metformin. And this is the most common one people hear about. Metformin, pre-marketing, they knew there were 20 different adverse effects. Post-marketing, another 8. So there's a total of 28 different adverse effects with metformin. However, there's significant considerations of GI effects, gastrointestinal effects, because 53% of all patients get diarrhea, 12% get gas, 26% have nausea and vomiting, 10% have heartburn, 7% get abdominal pain, and then they also can lead to vitamin B12 deficiency, that this leads to anemia and neuropathies. So, and there's also a black box warning with metformin. Big black box warning of lactic acidosis, which has been resulted in death, low body temperature, low blood pressure, and resistant slow heart rates. Okay. So lactic acidosis is the main thing that you're going to see with metformin. Now, this mostly occurs if you already have some underlying kidney damage, but if you've been eating this way, chances are you do have underlying kidney damage, because anytime you eat this man-made food, it does affect your kidneys and your pancreas and your liver and your brain and everything else. So that's metformin. Now, the fourth one, these are your GLP-1 agonists that everybody's talking about. Oh, isn't this a great medication? No, it is not. And I've already done a whole podcast just on this. Again, these are medications that will treat the underlying symptom of high blood glucose, but they actually make the main disease, insulin resistance, worse. So with this GLP-1 agonist, and like I said, I've already done a whole podcast explaining exactly what these are. GLP-1 agonists, there's these are the ones that end in tides. There's semaglutide, which is Ozempic, Rybelsus, and Wegovy. There's dulaglutide, which is Trulicity, exenatide, which is Byetta and Bydureon, and liraglutide, which is Victoza. All of these are common medications. All these do the same thing. And all of these have significant adverse effects. Even before these came out to market, they already knew of 39 different adverse effects with these drugs. Post-marketing was another 11. So just with these GLP-1 agonists that they're trying to push off onto everybody, there's already 50 different adverse effects that have been reported. And remember, only 1% ever get reported. So there's 50 different ones. The significant consideration on these, on the adverse effects, acute kidney injury, diabetic retinopathy in 7% of the patients, gallbladder disease, GI symptoms, gastrointestinal symptoms, and there's 22% and 20% are those are abdominal pain. Then 24% of the patients get constipation, up to 30% get diarrhea, 44% have nausea and vomiting, and then about 30% have hypersensitivity and pancreatitis, which means you're actually killing the organ that's producing the insulin that's supposed to be helping with the diabetes in the first place. So these drugs are horrible. And now we're seeing a lot of things like gastroparesis, where people's stomachs are just becoming paralyzed because of using these drugs. It's absolutely horrible what they're doing. And besides all those significant considerations, there also is a black box warning saying that these medications, these GLP-1 agonists, actually cause thyroid C-cell tumors. Okay. They're actually causing cancer of your thyroid. So this is no little thing. And right now, the FDA is actually evaluating several reports. Now that they've been putting everybody on these GLP-1 agonists, there have been several reports of suicidal thoughts. And they're trying to research that now to see if that's also caused by these GLP-1 agonists. So not a good way to take care of your health. You know, thinking you're going to eat anything you want to and just use something like a GLP-1 agonist to take care of it. That's not how it works. The next one is the DPP-4 inhibitors. And again, I've explained all these in my last podcast, exactly what they were, how they work. So I'm just talking about the adverse effects now. Your DPP-4 inhibitors are the ones that end in gliptin. So there's allogliptin, or linagliptin, which is Tridenta, Onglyza, which is saxagliptin, and sitagliptin, which is Januvia. So Tridenta, Onglyza, and Januvia. If you're on any of those, and there's at least 8 others in the same class. Pre-marketing, there were 5 adverse effects, and at post-marketing, there were 20, for a total of 25 adverse effects. The significant considerations with these is arthralgia, which means pain in your joints. And this includes severe and disabling cases of polyarthritis, which means inflammation in multiple joints. A lot of dermatologic reactions, a lot of skin conditions. Heart failure is another big significant one. Hypersensitivity reactions, and again, pancreatic events. So again, it's damaging the actual organ that we're wanting to help us get rid of our sugar. And then the last class, the 6th class, these are going to be our SGLT2 inhibitors. And these are the ones that end in agliflozin. So there's canagliflozin, which is Invokana, and there's dapagliflozin, which is Farxiga, and empagliflozin, which is Jardiance. So if you're on one of those, pre-marketing, there were 19 different adverse effects. Post-marketing, there was another 12. So there's a total of 31 adverse effects with this drug. The significant considerations are acute kidney injury, bone fractures, hyperkalemia, which means high serum potassium, hypersensitivity reactions, low blood pressure and volume depletion, infections, ketoacidosis, again, like we saw with a metformin, and also lower limb amputations. They're seeing more of that with these adverse effects. I know that was fast. You can go back and read it, listen to it again if you know that you're on one of these medications. But what I want you to realize is you are making this decision every single day, whether you want to eat for nutrition to help your body grow, health, thrive, survive, or if you're going to be eating for something else like emotional or convenience, or if you're addicted to carbohydrates. If you're eating for that, you're going to eat the types of food that's going to put you on these medications. And don't worry, the drug company loves that, because they tell you they've got a pill for every ill. So the more adverse effects you have, the more money they make, because more drugs they can put you on, and the more adverse effects you have. So realize you're making a decision. This is so important. And I'm going to end with this one little story that I really think it's just going to happen, but I think it magnifies what I'm talking about here. This is something that truly happened to me when my son, who actually just turned 27, when he was about 6 years old, he was out riding his bike. He's riding his bike and he fell off of it and he skinned his knee and he started crying. So I went over to him and I squatted down and was hugging him, and he was sitting there crying. And then just a little bit later, after he's crying, he just kind of stopped crying and he looked up at me. He said, Dad, he said, why is it that when kids fall down to get hurt, they cry, but when adults get hurt, they don't cry? I said, well, buddy, it's kind of like this. When you first fall down and get hurt, you start crying. It's just an automatic reflex. You just start crying. But you'll be crying and crying. Then after a while, you realize you're crying. Well, once you realize you're crying, now you have a choice. You can either stop crying or continue to cry. And with adults, we've been hurt so many times, we realize as soon as we get hurt that crying is not really going to help. So in general, we tend just not to cry. And that's where you are today. Before I started this podcast, I have a feeling a lot of you didn't realize that you were making a choice of what you were nourishing your body with every single time you put something in your mouth. Every single time you put something in your mouth, you should be eating for nourishment. You should be giving your body all the stuff that it needs, which I already talked about. That's the protein, the fat, the vitamins, and the minerals. That's what your body needs to keep functioning and keep you healthy. But if you don't do that, you're going to reach for all this other stuff because you weren't prepared, and that's going to make you sicker. It's going to make you go on these medications. They all have adverse effects, so you're going to be on more medications. So I hope before I start talking about this, you may have just naturally grabbed for this man-made food, not realizing how toxic it was and what path you were actually getting ready to lead yourself down. But I hope that after this talk, now you know when you go to eat something, you do have a choice, and that choice is yours. Please choose health. Your future self will be so happy with you. It's the best gift you can give your future self is healthy eating and healthy lifestyles now. And that's all I've got. I know I've gone over on this, but I really, really wanted to make sure that I told you about this and you understand. So I'll sign off here. And once again, thank you so much for listening and have a great week. And remember, always make simple, healthy choices to live a quality life.